And then, yeah, so we're going to cover ACEs and PACEs. And I think, honestly, a lot of this will probably be things that you've already heard or have heard in different contexts, but hopefully it'll still be useful. And we'll have some discussion questions to sort of get talking about our communities more specifically. So I wanted to start with ACEs, which is probably the component that you're more familiar with. So the original Adverse Childhood Experiences study by Kaiser Permanente and the CDC was done in the 1990s. And those researchers looked at 10 ACEs that I sort of group into things that happen to you, abuse and neglect, and things that happen around you. So those household factors. And they calculated every participant in the study's ACE score, which is just how many of these 10 things you've experienced. So a number from 0 to 10. And then researchers looked at the relationship between those participants' ACE scores and their health outcomes. And their key finding was that there's that dose-response relationship between ACEs and health issues, meaning that the more ACEs a person has, the more at risk for health issues they become. And that's like in the population in general. That's not at an individual level, of course, but it is overall. And so within Alaska from 2013 to 2015, we added ACEs questions to the Behavioral Risk Factor Surveillance Survey. And this is what we found in terms of ACE scores in Alaska, percent of the population in 2013. So this data is a little old at this point. But in general, what I think is important here is that compared to the population in that original study, more Alaskans had higher ACE scores than in that study. And they also compared Alaska, the CDC, to 5 other states that they did the ACEs BRFIS questions in, and Alaska had higher rates of ACEs than the average of those 5 states as well. So just in general, compared to the nation, we do have a higher burden of childhood adversity here in Alaska, but it looks from more recent data like that might be trending down for younger populations, which is a hopeful point. And one finding that I think is particularly interesting from that 2013 data in Alaska is looking at adult mental health in Alaska by ACE score. So for these 3 mental health outcomes, you can clearly see that dose-response relationship where Alaskans with higher ACE scores are more likely to experience these mental health indicators like not getting adequate sleep, depression, and reporting frequent mental distress. And I'm highlighting mental health because we're going to look at mental health also with the positive childhood experiences. But I do always like to note that physical health is also impacted by ACEs. One thing we know is that the risk of cancer increases the more ACEs someone has. And so that's a health outcome that's not directly tied to sort of any particular behavior that a person might have that would lead to that outcome. So we know that there's these physical effects on the body through toxic stress that is associated with those adverse childhood experiences. And then one thing that I think it's important to note when we talk about ACEs is that those 10 original experiences included in the 1990s study are, number one, not the only adverse childhood experiences that children can have. There's other experiences that are also traumatic. That's not a definitive list, but also that adversity in families is connected to adversity in communities. And so the Pair of ACEs tree from George Washington University, I think really helps to illustrate how that's true. So the leaves on the tree are ACEs, and those are easily recognizable. They show up, we can ask people about them in clinical settings, and we can figure out like what's going on with an individual. But what's not as easily recognizable sort of is the soil that produces the leaves on the trees. So if a tree's roots are growing in soil that's toxic, the tree isn't going to thrive. And similarly, if we have systemic inequity in our communities or trauma in our history, then that can have the effect of producing adversity in families. But the underlying conditions that create that adversity are not always easily recognizable. So if a community experiences hardships, that makes it harder for families to thrive. And I think that's important to note, rather than just pinning ACEs only on the family, that families are created in a community context. And so I wanted to pause here and just ask you whether this is something that resonates with you, and also how you see this connection between community and family adversity show up in Sitka and the settings that you work in.
How it resonates. Well, I guess I'm thinking of a woman I met with yesterday who actually committed an assault on her boyfriend when they were drinking. She was arrested, faces felony charges. The kids were home upstairs sleeping, and she kept repeating, well, they were fully asleep. You know, they didn't see anything. Yeah, okay. But I'm thinking about this tree, like, they're gonna hear or see something, whether it's the after effects or the before, when they saw their mom drinking. Like, it's not something like they're experiencing. They're not experiencing anything just being in their room, but the before and the after, like, they're still affected. That's what I'm thinking. So they may not have seen the actual violent act, but it's in their home. And how can you have a home that's healthy when mom is being arrested for assault and she was drinking, and that, you know, so that's kind of what I'm thinking. I'm still thinking about this mom. That's what I'm thinking.
Yeah, thank you. That makes me think of the Philadelphia ACEs study, where they added a bunch of questions to those original 10. And one of the things they looked at was just like, is there violence in your community? And that didn't have to be violence that children had personally witnessed or experienced, but having that just sort of in your community atmosphere that you know it's there, that they proved has an impact on children as well.
Mm-hmm.
Well, just to, I guess, add to or pair off of what Melanie was sharing, is looking at the, you know, the root system in the dirt, is that parents of the children that are friends with those kids that may not have actually witnessed the crime, but they may be talking about it, and their kids are there, and then those kids are going to school and they've overheard the name, and so then they're talking about it with the children that maybe didn't witness it firsthand. Just like the community gossip, drama, just how even that outside environment could impact the kids, making them feel ashamed of something that they didn't even have control over. Just, you know, you can only imagine the different ways that it can impact them, even if they weren't directly witness to it.
Mm-hmm. And that reminds me of, like, here in Sitka, and we have a Sitka Police Department Facebook, and on there they do like posts of the arrests of the recent people they've arrested for drug charges, you know. So like you have these mug shots of these, they're kids, you know, like early 20s, 30s, in their orange uniform, you know, not smiling, with the mock part, you know, the what is it, the
pock marks,
pock marks on their face. And, you know, it's just it's a shaming thing, like a consequence of being caught and charged in your community. But I think that affects our community too. Like, yes, we want them to be held responsible, but they're probably seeing their family.
But Melanie, so in one instance with this recent one that Mel is referring to, is she lives right behind the family that's experiencing the effects of what their son was charged with drug stuff. I live just 2 houses up from them. And so, you know, 2 people that are nearby and thinking about this family that's being affected by it as well for something that their son did.
Yeah.
Yeah.
So I don't think any of them have kids, but it's part of this root system, I think. Part of the community.
Yeah. Yeah. I love the tree metaphor because you can't separate the parts of the tree. And I think sometimes we think of families as like distinct entities, but they're not. You're just highlighting those examples of how we're all connected.
Yeah.
Sarah, anything to add?
Yeah, I think it also reminds me of the Philadelphia ACEs study and thinking about how also in like cities, even if a kid gets to live in a home that's safe, if you know that there's violence in your community, that causes stress, like on your way to work or on your way to school. So we can't just look at like the family and the community as separate, like Liza is saying. Yeah.
Mhm.
Yeah, I also think a lot about, in Hope, they talk specifically in that training about how this ACE of incarceration. So if we know from research in the United States that certain racial groups are incarcerated at disparate rates, like that ACE is going to affect families differently, children differently. You're going to have an ACE score of having an incarcerated parent that in part is created by those systemic inequities in our justice system that have led to those disparities. So it's not something that families or individuals have total control over. It's also a product of our societies.
Mhm.
Okay, so I wanted to do an exercise that we do in the Hope training. So what stands out to you all first when you look at this picture?
Chaos.
Sure.
Yeah.
I see safety to an extent. I see a family in a chaotic environment, but I see a family.
Sarah, what stands out to you?
I was gonna say, like, you can see certain things that are important to the family. Like there's a religious picture on the wall. Maybe like the boots and like the food tell you certain things about what they like to do and what they like to eat. And then like the dog and the cat, like they're pet people.
Mhm.
Yeah, I think the general sense of chaos always stands out to me. And then I like, yeah, the religious thing on the wall. They've got a sense of spirituality. The bugs always stand out to me too.
Mm.
So Tufts created Hope because their impression, coming specifically mostly from work with pediatric doctors, was that a lot of our current systems, especially in healthcare, screen for deficit. So we're screening for things that are going wrong in children's lives, like looking for ACEs at a doctor's visit. And that's not inherently bad, but it does teach providers to focus on looking for challenges. And so a lot of the time when I do this exercise with groups that have a lot of providers, they go immediately to all of the things that they see that are like potential safety hazards in that picture, and not to some of the things that you all picked up on, like the spirituality and the pets and the fact that the whole family is there together, which are these real strengths that they have. And so that creates this presumption of deficit when we're only focusing on those challenges. And the idea of hope is that we need to shift that narrative and make strengths just as important as challenges. And part of why hope says that's important is because it helps combat implicit bias. When we change the narrative and we include the positive as well as the challenges, we're recognizing every person's inherent dignity, and we're not seeing people as just collections of risk factors. And so that helps us to combat implicit bias, and also by focusing on the strengths that people have, we can take a lot more of a closer look at either the things that are going well in the family and in the community that help them access those positive things and have those strengths, or the barriers in the community that are making it hard for certain families to have access to those positive childhood experiences and those resiliency skills that are going to promote good outcomes. So the first sort of large scale study on positive childhood experiences was done in 2015, and researchers added 7 questions about positive childhood experiences to the behavioral risk factor surveillance survey in Wisconsin. And so they asked them these 7 questions about positive experiences they had had in childhood. And they also asked the 10 ACE questions as well. And what they found was that there's this same dose response relationship between positive childhood experiences and mental health that there is with ACEs. So the more positive childhood experiences a person had, the more likely they were to have good mental health as an adult. And the thing that I think is super interesting is that this was true even of the populations that we would generally consider high risk for poor mental health outcomes. So specifically those with 4 or more ACEs. So for people with 4 or more ACEs who reported only 0 to 2 positive childhood experiences, we did see that big mental health effect. 60% of those individuals reported depression or poor mental health. But when you get to those individuals who had 6 to 7 positive childhood experiences, that dropped to only 21%, which was more in line with like the general population. So positive childhood experiences are protecting against those negative effects of ACEs, or potentially helping to heal some of those effects. And research since then has suggested that the absence of positive childhood experiences might actually be more damaging to long-term health outcomes than the presence of adverse childhood experiences. So not having those strengths might actually be more damaging than having some of that trauma. And what the HOPE research team did is they took all that information about positive childhood experiences and they slotted it into 4 categories that they call the building blocks of HOPE. And those are those 4 key elements that are crucial to creating positive childhood experiences in kids' lives. And so those are relationships. And here they really stress positive relationships for children with non-parent adults. That's crucially important, they say. Environments, this one is, they really stress that, you know, we have to meet kids' basic needs for safe environments. That's a crucial positive experience. Social and civic engagement. And this is really about developing a sense of belonging in your community. Sometimes people get hung up on this one because they're like, well, kids can't vote. How are you civically engaged if you can't like participate? But I think that's thinking of like civic engagement more in a formal sense, whereas the Hope team really stresses that there's lots of ways to give back to your community and feel connected to your community, and kids need to experience that. And then emotional growth, which is really about social and emotional learning and having that time for kids to play and interact with peers and develop those self-regulation skills. And I think something that's really important and like my favorite thing about Hope is that they always stress that these are community defined. So the building blocks don't look the same in every community because different relationships, environments, ways of engagement, and opportunities for emotional growth exist in different places, whether that's because of culture or because of location. And so it's up to every community to identify what's important to them within these categories and then how they can work to promote it. And so in the Hope training, we ask folks to identify really what these building blocks look like in their community, and then what resources exist in their community that help children access these building blocks. So I'd love to hear from you, maybe for one or two of the building blocks, what's an important way that children get access to that? Or what does it look like for children to access these building blocks where you are?
I think a strong one for our kids in the community is their relationship with their teachers, like at least the younger level. I think as we get into junior high, high school, I don't know what happens. Yeah, it diminishes. But I think at the lower levels, kids usually just love and adore their teachers, and the teachers really connect with the kids. That's one way on relationships. I don't know.
And I think, through a lot of the community activities that go on, that you develop relationships, because we are a smaller community and there are a lot of like different agencies or groups that do a lot of activities throughout the year. And so you're seeing the same people over and over again, which is creating relationships between the children and the, community partners.
Would you say, Jean, that ties into the civic engagement one as well?
Absolutely, because I see where there could be a lot of opportunities for kids to actually get involved and doing like volunteer or just being a part of it, like serving elders. It's huge. Every time I think of any of the public events that we do for our tribal citizens, that we call upon the youth to come up and serve their elders. So that right there is creating relationships, multi-generational, which is amazing.
Mm-hmm.
And yes, that's part of the civic duty or civic, sorry, I can't see the words there on the side, but
Yeah, there's
the civic part.
I think there's a real sense of community regarding that one. Like we didn't have a playground, like a good playground, and like the whole community like came together, fundraised. We have a great playground now. And now kids have another safe place to play. So yeah, that's just one example. Like if there's a need, it seems like the community comes together.
I love that too, because that ties into like civic engagement. And then you end up with this great playground, which is that safe environment and an opportunity for emotional growth.
Yeah.
And creating relationships.
Yeah. Sarah, anything to add?
Yeah, I was gonna say something quite similar actually. Like as I was hearing you all talk, I was thinking about places in my community where I grew up. For example, there was a Boys and Girls Club, and it looked like it fit into all of these because it was like a safe environment. You could make relationships with kids and the adults leading the activities there. It's also like a place for kids to play together and get those emotional growth skills. And then also like providing volunteering opportunities to give back to other people in the community. So I think a lot of times like the playground you're talking about can be a source of almost all four of the building blocks.
Mhm.
Definitely. And one of the reasons I really like the HOPE framework is because the other thing I think it helps us to think about is like equity when it comes to positive childhood experiences. So if we take like playgrounds as an example, those help children access all four of these or can. But in some larger communities, if we look at like, well, where are playgrounds placed? And which children have access to them, which have the means to get there and the family to take them. That's not always like equitably distributed within the community. Certain children are left out. And so by looking at which children have access to which of these opportunities, I think it's also a great way to start addressing or identifying some of those systemic barriers that the pair of ACEs tree looks at.
Mhm. I guess that reminds me of, our special projects money. It's expensive to go swimming here. So I would think that many of our tribal citizens are not going to be able to go swimming unless it's offered through us. So I think I'm really proud of the fact that we can offer swimming. The kids are gonna have a safe place to go. They're learning a skill. I mean, we live on an island, so we're around water. Like all our kids need to learn how to swim. They have to be able to pass swimming in order to graduate. And so how are they going to do that? They're not going to want to swim in cold water all the time. So you think it's like, oh, no big deal. You pay for their swimming, but I think it's a big deal and it fits these building blocks.
Yeah, absolutely. I mean, even just the cultural family activities that we've done this summer of going out on one of the Alamarine cruise boats and either getting dropped off at a beach or doing the wildlife cruises, that there's all of these, it fits all of those as well, because we've got multi-generational, we got relationship building, we got civic, like I said, we asked some of the youth to come up and serve the elders, so connectedness, safety amongst, familiar faces and getting to know, what was the last one?
Relationships, safe, equitable, stable environment, social and civic engagement, emotional growth. Yeah.
Yeah, absolutely.
And like Mel said too, again, affordability, and that was some of the feedback, because we do feedback or satisfaction surveys. And that was some of the things that were identified from a lot of our families with each one. There was at least one person that identified that we haven't been out on the boat in years because we, don't have the money to fix our boat, whatever it is, or I haven't been out on the water in years because I don't have a boat. So it's just been amazing to see how much people are really enjoying these.
Good
It's so
point.
amazing that you can offer that.
And that's with ACT money. Thank you.
Yay! Oh, that's so great. It makes me so happy. So one of the other things about, so ACEs are harmful in and of themselves as traumatic experiences. But one of the things that I think we think about less often is how ACEs impact children's ability to access positive experiences. So if a child lives in a home that is abusive or neglectful, that disrupts their access to those foundational positive relationships, and it can disrupt their access to a safe environment. And similarly, adverse community environments, growing up somewhere where you're witnessing violence or where, the streets are just not safe, can reduce your opportunity to engage with your community and to access those opportunities for emotional growth through playing with your peers. And one thing that HOPE asks us to look at is which of these building blocks is being disrupted by those negative experiences, and then how can we replace it in another area so that the child can still get access to that positive experience, maybe even if they've already experienced an adverse childhood experience. So yes, we want to prevent those ACEs, but for those children who've already experienced ACEs, how can we replace those experiences with other positive ones to make sure that they're still getting all of their positive experiences, which we know is going to contribute to great mental health in the long term. And Washington recently made a whole community resilience tree to supplement that pair of ACEs tree earlier. And so really it's just the opposite of that pair of ACEs tree. We know that if we create equitable systems through things like restorative justice or health promoting infrastructure, community-driven policy, then that will lead to resilient, flourishing communities. And so by putting these equitable systems in place, we promote access to these positive childhood experiences. And so one of the things that it's always useful to think about is sort of what are the things in your community's soil that can promote flourishing, thriving families, just like healthy soil can create those healthy leaves on the tree. So that is my little overview of ACEs and positive childhood experiences. And so I just wanted to give a quick resource list, and I'm going to send some resources later, but we have that Introduction to Hope training, the full thing that we offer through ACT. There's also tons of really great Hope handouts on the building blocks at Tufts website all about this. And then there's this really cool new pair of ACEs tree and community resilience tree that gets participants thinking more about what's in their community's soil, whether it's positive or negative, and how that's impacting families. And it comes with this really fun worksheet for that, which is great for like community brainstorming groups. I have one more thing, but I'll pause here for questions or comments.
I don't have any.
Well, first of all, I want to say thank you. The way that you're presenting it is exactly what I would expect, is that, you know, we want to identify some of the challenges through the ACEs, and then being able to identify the resiliency through the PCEs as well. You know, having that strengthening families, strengthening community approach, because yes, we want to identify what may not be going right, but then being able to be problem solvers and coming up with ways that we can help create that atmosphere of safety and well-being for people. And I'm looking at the resilience tree piece of it, and looking down in the dirt and the roots is, there's like nearly 100%, even just within Sitka Tribe of Alaska, of what's already going on in the trauma-informed systems and supports. So I want to acknowledge that, and then being able to like continue to build on that just within our tribal community, and then a community as a whole.
Yeah, I think a lot of communities, they already have the building blocks of these healthy systems. It's just building on that and expanding programs that people are already doing, which is great. So to end, I always like to end with something for a little bit of mindfulness for self-care. And so I have a poem for us to listen to. There's this amazing resource through the Library of Congress, all featuring Native Indigenous poets from around the country. And I just thought that this one fit so well with our theme that I wanted to share it. So I'm going to share my screen again, but with sound this time. Okay.
Welcoming Home Living Beings by Suzanne Schoen Harjo. Today, we welcome home beloved living beings. No one alive today has seen them at home, except in dreams. No one we ever met saw them at home, except in dreams. Yesterday they were stolen many generations ago. Yesterday they were prisoners in private houses. Yesterday they were locked in university basements. Yesterday they were poisoned and smothered in museums. Yesterday they were branded with numbers and price tags. Yesterday they were violated by prying hands and eyes. Yesterday they were tortured and deprived of all that nourishes. Yesterday they were alone, many generations ago. Today we welcome home beloved living beings. They come to us, their many relatives. They return after surviving a long, hard war. They never were meant to be warriors. They were created with holy purpose, as teachers and doctors, as visionaries and guides, as children and parents, as artists and lovers. They were created to balance our minds, to settle the spirits, to solve difficult cases, to make a peaceful way, to make themselves beautiful. They were created by creation and loving human hands, as pots and baskets and boxes, as claws and feathers and teeth, as hides and furs and antlers, as hooves and shells and baleen, as pouches and bundles and gourds, as drums and rattles and bells, as clay and cedar and paint, as grasses and reeds and pollen. Today we welcome home beloved living beings. We, their many relatives, have known them all our lives. We, their many relatives, have missed them all our lives. We feed their memory with sacred foods. We nourish their memory with sacred waters. We keep them in our circles. We seek them in the darkest places. We sing the songs they sing. We dance the dances they dance. We pray the prayers they pray. We dream the dreams they dream. Tomorrow, after we welcome home our beloved living beings, it will be as if they never left home or us, their many relatives. It will be as if they never left home or us. It will be as if they never left. It will be as if they never. It will be as if. It will be. It will be as if there were no yesterday. It will be tomorrow.
Okay, so thank you both so much for joining, and I'm sorry again that it was just me and no Tara today.
That's all right.
Thank you so much.
Yeah, I'll return roughly 13 minutes of your time to you.
Thanks, Eliza. Nice to meet you, Sarah.
Have a good weekend.
You as well.
You
Enjoy
too.
your weekend.
Okay, bye-bye.